Okay. Then here. Oh. This only, no? Oh, here. Okay. Sorry. Good morning, everyone. Check cheyara. How are you all today? Do you all remember what I have taught you all in the last class? Is it about primary health care or not? Okay. In continuation of my previous class, which I was telling you all about the job chart of medical officer. He is not only a manager but he is also a physician. So I would like to continue it. Today will be the last class for the primary health care. So I was taking continuously 4 classes. So today is the 4th class. So we'll end today the primary health care. So let's start. So you all know about your specific learning objectives, which I told you all in the last class. Then coming to the in continuation of the job chart of the medical officer, the most important in continuation of what I told is about the rehabilitation. How do you define rehabilitation? What is rehabilitation? Can anyone define it? You can put in the chat, which Dr. Hema will be checking. What is it? It is combined and coordinated effort of both medical, physical, everything, all those components. So the medical officer of primary health center, it is his duty to prevent disabilities. And then the other important thing is he has to detect by screening. What are the common diseases for which we screen at primary health center? Whenever somebody comes, seeks health care at our primary health center, it's mandatory to check their blood pressure. So if we look at their blood pressure, or if you just check their blood pressure, maybe he or she is has high blood pressure. So that is one of the important screening aspect of at primary health center. In addition to that, other screening programs which you will be learning when you are posted at primary health center are the women are usually screened for breast cancer. I'll give 2-3 important examples, and this question is asked in the Viva. In the exam we usually ask you all, what are the common screening tests which you do at primary health center? The most important which you do in a pregnant women especially are, one is your VDRL, you screen for syphilis, and then you do blood grouping and RH typing for RH incompatibility, and then you also do for hemoglobin percentage. That is also a screening test wherein you want to detect anemia. These small things, like and checking the urine examination for albumin and sugar, for gestational diabetes as well as for pregnancy induced hypertension, especially in primigravida. See, this community medicine or PSM, it is a very comprehensive subject wherein you all have to integrate what all you learn at different departments. When I talk about screening, then you must immediately, your mind should go to your OBG as well as for the newborn, wherein you screen your pregnant women as well as the newborn. So that is very important. Why you screen and all, you will be learning later. Then after screening, do you think you all had to counsel them? Yes, of course, you had to counsel them. And in addition to not only deduction, you had to counsel and you had to also provide a service. What are the other things for which you counsel, especially the pregnant women? Why I am going on telling about pregnant women? Maternal and child health is an important element of primary health care. So, counseling the pregnant women about nutritional requirements, what she has to eat within her budget. Don't tell something which is beyond her reach. And then other thing is, one other important aspect which government of Telangana has introduced is the primary health center medical officer has he is given the power to issue disability certificate. So you should know how to assess that for the disability, what grade it is, and all these things you will learn your surgery or orthopedic posting, and you have to certify correctly, otherwise you are responsible for your certificate. Then you all know that we have a very high maternal mortality. Maternal mortality rate is very high in our country. So do you all know how to define a maternal death? What is maternal mortality rate? Put it in the chat. If you do not know it, go back and read, because once I start telling all these things, I may not complete today, so I don't want to go into it. And whenever there is a reported maternal death in your area of your 30,000 which is covered by a primary health center, you have to do an audit, that is a review. You have to find out what went wrong, why she died, and whether it was preventable death or not. So that is done at the primary health center. Then your linkages, of course you all know that there are sub-centers below primary health center, and I told you all about these things. I am not going to repeat. Then monitoring and supervision for the doctor especially, he has to do two things. One is providing medical care, and other thing is he has to visit the sub-centers regularly. And what he has to do, he has to support, he or she has to support the multipurpose health workers who are posted at the sub-centers by doing periodic visits. Then coming to national health programs, there are a number of national health programs, around more than 20, which are implemented throughout our country. The most important health programs which you should know are like tuberculosis program. There is a program for tuberculosis control which is under National Revised Tuberculosis Control Program. So I am just showing some pics so that you will remember. And then coming to leprosy. Leprosy, you all can see one patch here for this boy on his face. So National Leprosy Eradication Program, where we stand, what we do, you will be learning in your programs. Then coming to National Vector-Borne Disease Control Program. This is an integrated approach wherein you will learn how you have to control the vector-borne diseases. What are the common vector-borne diseases which you know? At least name one or two in your chat. Let me tell you all. It is malaria, filaria. Please don't forget at least these two things. And then coming to filaria program, there is something called to control filariasis. In our country, we do mass drug administration. You can see how the staff, medical officer, how she is inaugurating this MDA program at one of the primary health centers. Why am I showing all the pics? So that you will remember and you will at least answer and write. Write in a exam which is relevant, not the pages. Pages don't count. Okay. Next, coming to National AIDS Control Program. National AIDS Control Program, you all know that there is a national program under National AIDS Control Organization. It is a centrally sponsored program, and in next month you have something called, what is that? Find out and let me know. In December, it usually comes in December. Then your Indradhanush, this is also frequently asked in exam, and some of you can read Telugu, I think, or most of you should be able to read because you all are in Telangana, so you should learn to read Telugu. So it is written here as Chinnarlaku Tika Rakshan. I think this Indradhanush, don't forget it, learn everything about it. This is usually asked as a short question for 4 marks, or it is asked in Viva. Then coming to newborn care, and what is this MNIC stand for? It is Integrated Management of Neonatal and Childhood Illnesses, wherein you have all these components which you will learn. Then your vasectomy camp. This is a camp which I have organized when I was a district head at vasectomy. I had this pic, so I have just wanted to show you all how we organize vasectomy camps at primary health center. Then your school health program. This is a government school. This is a Jilla Parishad school wherein we have conducted school health program for these children, and the pic was taken by me, and so I have wanted to show you all that usually the government schools are covered. And then coming to job description of your multi-purpose health assistant. Just hear to me very carefully. Multi-purpose health assistant, he or she, they are the supervisors. Previously they used to be called as MPHS, but now it is replaced by A, that is assistant. What do they usually do? There are someone who are working below them at sub-centers. It is a multi-purpose health worker. So what do? Whatever the work the doctor does at his primary health center, the MPHA also does at her level. So what she will do? She will supervise, she will go to the sub-center, she will do home visits, she wants to conduct meetings, then she will coordinate, she will check whether that multi-purpose health worker needs some drugs, whether the stores are in place. Then she will also ensure that all the blood samples are collected from fever cases to rule out malaria. And then there is also something called spraying of the insecticides in the home at the house level. So she has to supervise it, whether it is really done or not. In the similar way, she will also make home visits, and she will also see whether all the national programs which are covered by the multipurpose health worker, all those things. Like if it is a leprosy case, she has to ensure that the leprosy cases are taking their medication regularly. If it is a TB case, ensure that they are no defaulters, to motivate them. Why are we interested in reducing the defaulters? Because we are responsible for multi-drug resistant tuberculosis. If they are do not take the treatment regularly, and if they are the defaulters, it may result in multi-drug resistant tuberculosis. Then of course, chlorination of water sources, you all know how important it is. I told you all in the last class. Then the female, I was talking to you all about the male. Now coming to the multi-purpose health assistant female, it is one and the same, but here she usually takes care of maternal and child health, in addition to control of communicable diseases. What are those communicable diseases which are usually endemic? For in India, in Telangana, what are the diseases which you come across which are endemic? What is endemic means? Can anyone define what endemic is, what epidemic is, what pandemic? Are we facing any pandemic now? Okay, put in the chat. Just write in the chat, we'll see how much you all know it. So you should know what are the diseases which are prevalent in Telangana state. We don't have Kala Azar, which I have shown here. The Kala Azar is mainly prevalent in Bihar, Uttarakhand, etc. But lymphatic filariasis, you have it. Japanese encephalitis, you have it. Then in addition to this controlling of communicable diseases and other things, there is also one component which is training. Whom does she train? The supervisor or the health assistant. She trains the ASHAs, or she trains the trained birth attendants, so that they will be, it is like reorientation. First training is given only at the recognized or training center, which are there at headquarters in Hyderabad. So maternal and child health, of course I told you all, which includes our family planning. And MTP services, they are only there in few of the selected primary health centers. It is not there in all primary health centers. In addition to that, nutrition, immunization. ARI is nothing but it is acute respiratory tract infections. Then the school health, of course, and other things. Health education. Health education is very important. Am I very fast? Are you all okay with me? Please respond. ఏమైనా రాస్తే చెప్పమ్మా. అసలు లేరా? ఏమంటలేరు. సో అంతే వెళ్ళిపోయారు యాజ్ యూజువల్. ఓకే, ఈ వీళ్ళల్లో కూడా ఐఎమ్ ఫాస్ట్ అని అడిగితే ఏం చెప్తలేరు. ఓకే, so I think you all are able to follow me what I am telling. So in addition to other things like water, spraying, treatment of the patients, everything is just like the doctor, but it is at little lower level. That's it. And control of blindness, of course. Notification of the diseases. Tuberculosis, don't forget that it is a notifiable disease since 2015. From March 2015, it has been Government of India has made it mandatory to notify tuberculosis. That's very, very important. Please don't forget. And the vital events and record keeping, of course. Look at this picture. I wanted to show you all the picture of this is fogging, and which is done at household level. You can see the worker who is using the sprayer to do the insecticidal spraying. Here is one important, this is a sub-center. You can see the health worker here, and here is our supervisor. This is at sub-center, I don't remember, maybe, yeah, I think it is at Yapran, if I am not wrong. But I wanted to show how a sub-center looks, because I do not know whether you all are taken to the sub-center, primary health center or not. But at least when the examiner asks, you should be able to tell what you have seen, at least in the picture. These are the pictures which, when we have taken our students, I used to take the pics and I used to keep, and these are the same things which I wanted to show to my students, so that they'll remember what they have seen. But here I have not accompanied you all, so I don't have the pics. You have to bear with me. Then here you can see how she is keeping the things ready to take care of the OP. Then comes your health worker. Health worker again has all the components of primary health care, that is all the 8 elements which you all learnt it. So it is treating the diseases, then maternal and child health, then family planning, nutrition counseling, immunization, and then treating the minor ailments, etc. Okay, and recording the births, deaths, marriages, etc. Look at this pic. Are you all not excited to see this? This is at Primary Health Center Halwal, wherein all these mothers, they are holding their children for immunization, to ensure that their infants are immunized. See such a big long line, and I think you all feel happy to see how committed the mothers are to bring their children for immunization. Remember the immunization schedule. It is a very, very important question which is asked as a short question, and every student is asked in the Viva about immunization schedule. Please write without seeing. First learn, write down, and it is like self-evaluation. Now you all are adults. We don't have to take tests. We don't have to ask you all whether you learned or not. It is for you all to learn. You know, we are here only to facilitate. I will be telling you all as I take classes what is important, and it is for you all to prepare yourself for the exams as well as to take up your job as a medical officer at Primary Health Center. Then other things, of course, that that is nothing but it is National Vector-Borne Disease Control Program. I have put the short form because I cannot put it everything on this slide. All other things I have already covered. So in addition to that, you are the health worker. Next coming to ASHA. Who is the ASHA? ASHA is a health activist. Who is she? She is the link worker. She will link the community with the health facility, whether it is sub-center, whether it is primary health center, whether it is district hospital, whatever it may be. She comes from the community. So she is a link worker. Her selection, everything, there are criteria for that. What does she do? She provides information. To whom does she provide information? To the facility, whoever is there, like multipurpose health worker or to the doctor. And what will she tell the community? She will tell the community to seek health service whenever it is necessary, and she will mobilize the community, and she will work with a village health sanitation committee, and then she will also escort the pregnant women. She will come with her, then she will see that she is registered at the sub center or the primary health center, and after registration all other things will flow. Like there is a flow chart and you all have to learn it, how the registration and then what all you have to do, everything you have to know. So it's very, very important. And then also inform about births and deaths. She will integrate Anganwadi workers. Where are these Anganwadi workers positioned? I told you all that they are at the Anganwadi center, and the Anganwadi centers are not under health department. They are under women and child welfare department. It is a different department. Again I repeat, this is asked in the Viva. Next, coming to very, very important program. This is very much linked with our primary health care, comprehensive primary health care. The Ayushman Bharat. Who has introduced Ayushman Bharat? Do you all have any idea about who has initiated this Ayushman Bharat? It is our Honorable Prime Minister Modi who has initiated this Ayushman Bharat. Why am I telling about Ayushman Bharat today? This is about he has introduced comprehensive primary health care. Because I am teaching primary health care, I want you all to know about Ayushman Bharat, which is very, very important. The whole world is looking at us, what we are doing under Ayushman Bharat. Let's see what we are doing. Can you see this logo of Ayushman Bharat? What does it tell? It is asking us all to keep our health, and also if we are healthy, our wealth is saved. Got it? Okay. Yeah. Now you see, this is a very largest comprehensive healthcare scheme. What is under this Ayushman Bharat? What are they doing? Under National Health Protection Mission, they are covering all the vulnerable families. How many are going to benefit? It is around 11 crores. And it is across the country. There is no differentiation. North, east, west, south, nothing like that. Wherever you are, wherever you live, you are protected under this scheme, provided you meet that criteria. And then how much insurance coverage is there under this scheme? It is 5 lakhs per year per family, irrespective of family size. How much the family size may be. Nowadays the family size is very small. As per the NFHS 4, it is just 2.5 or 2.3, I think. I am not sure. You find out and let me know. And then they are covered both under public and private hospitals. So if a person wants to go to a private hospital because there is no public hospital or the government hospital in your area, still you are covered under this scheme. If you have an emergency and if you go to the private hospital and money is spent, you are covered under this Ayushman Bharat. This is nothing but it is comprehensive primary health care. So I was telling you all, and how is it implemented? It is implemented through our primary health care through health and wellness centers. It is renamed actually. The primary health centers are going to be renamed as health and wellness centers. They don't want it to be called as primary health centers anymore. And it is a very major milestone in the history of our public health in our country. And what is the purpose of having this Ayushman Bharat? It is going to reduce our mortality as well as morbidity, and out of pocket expenditure is reduced. If somebody meets with an accident and the victim did not do and the family do not have money, they can go and avail a service closer to the place where he has had an accident, and he is covered under this Ayushman Bharat. How many people have benefited till date? It is the 45 lakhs of people have benefited under this scheme. So it is the world's largest insurance scheme. Largest, because of our huge numbers. Do you all know the population of our country? How much it is? Put in the chat. Let me check. I came to know that only 5 or 7 of you are there. At least out of 7, 1 of you can post it or message or whatever you like. Please do it. So I already told you all that the amount of nearly 5 lakhs per family per year is covered under this Ayushman Bharat. How many sub-centers and primary health centers are transformed? Till today, 1.5 lakhs of sub-centers and primary health centers. They are transformed into health and wellness centers. What does health and wellness centers do? They provide comprehensive primary health care. I defined you all what comprehensive primary health care is in my 2nd class. Do you all remember that? Go back and read again once more. So look at this pic. The comprehensive primary health care. I think you all learned about the principles of primary health care, about the accessibility, affordability, equity, etc. etc. The same principles have come along with one more important thing, which is quality linked. Otherwise all 3 are one and the same. Do you think or not? Accessibility. If you provide a service, it should be accessible to the community. Affordable. It should be affordable by the community as well as by the country in which we are living. And then your equity, it should be equally distributed. Not only the cities having large hospitals will not serve us because 70% of the population lives in rural areas. Then quality linked. It just don't have to count the numbers. We should know that we have to provide a quality service. That is comprehensive primary health care. So these are the things what again once more I want to reinforce, saying what comprehensive primary health care means. It is provided at a low cost. The important objective is to reduce our mortality, morbidity, and how can we reduce the burden of the tertiary care and the secondary care? If we provide a service at primary health center or at the wellness centers, the burden reduces at secondary and tertiary levels. As per the survey, only 11% of the population use primary health centers. Only 11%. And it is the primary health care, it is beyond first contact care. And it is like a two-sided sword. It is 2 ways. It will work 2 ways. It will also support higher level facility. It will also help us to refer the cases, and they will come back, and again they are in the same community wherein we give them follow up. So this is what I was telling you all, supporting the individual and population health interventions. Okay. In addition, we also supply free medicines. Free medicines are supplied at wellness and health and wellness centers. Look at this. This will help in maintaining regular supply of medicines. The medicines are provided at free of cost by Government of India. Do you all know about National Health Mission? National Health Mission, it is the flagship. It is one which through which we strengthen our health systems. Strengthening the health system programs, and all the national programs have to be implemented through our primary health center. So we want to strengthen it. So in particular, especially primary and secondary health care. Why do we want to do that? We want to attain universal accessibility of the health care to all population, the whole population. by providing at equitable distance, by ensuring that they are affordable, by ensuring that they are of quality services, and we are also accountable and responsive to the needs of the people. So we are accountable to the health needs of our community. That is our 30,000 of population, which is covered by the primary health center. We are also responsible to meet their needs. Then what are the services which are expanded under this wellness, health and wellness centers? Of course, I was telling you all about maternal and child health. So the care was actually, it is strengthened to by increasing the number of primary health centers which function 24/7. Very few primary health centers used to function 24/7, but now Government of India wanted to increase the number, so we have increased the number of primary health center which function 24/7 with more doctors and the staff. Why do we want to do that? It is again providing the service, reducing maternal mortality, because if it is accessible and if they deliver at the service centers which are closer to the house, to their place where they live, ultimately the death rate comes down. In addition, we also have some neonatal units. The neonatal units are set up at community health centers, that is at the first referral unit. Why do we want to take care? Again, to reduce our infant mortality rate. When you look at the graph of the infant mortality rate, it is like flat now, because now we had to concentrate on the neonates. If the neonatal deaths, which are more in India, if they come down, the infant mortality rate comes down. That's why the government has strengthened the community health centers with a neonatal unit at community health center. I think you all have to visit community health center also to see how it functions. And then your childhood and adolescent health services. The adolescent health services are provided through ICDS, that is at Anganwadi centers. It is not under primary health center. Please make note of it. The childhood illnesses, of course, immunization, taking care of the ARI, diarrhea, everything is at primary health center. Then what is this RCH stand for? RCH is Reproductive and Child Health Services. That is nothing but it is an integrated approach. In addition to family planning, we also take care of the reproductive needs. And then management of communicable diseases, of course, I told you these two things I already covered. Screening, I told you all about the screening. Management of non-communicable diseases, it's just one word about it. In primary health center, the government has introduced screening of all who have family history of diabetes or thyroid, etc. Their samples are collected and they are tested for blood sugar as well as for thyroid levels, the hormone levels. So to help them and manage them. That is how the non-communicable diseases have entered into primary health centers. Then common ophthalmic, of course, you all know conjunctivitis is so common with which people come. You should be able to tackle them. And the ENT problems, usually the children who you are usually brought with ear problem, ask for the history of measles, because ear problems, it is one of the complications of measles. This is how you should learn to integrate and cross check. Oral health, of course, I think the dentists are sometimes posted, but regularly there is no dentist at primary health center, but you should know where to refer them. That's important. And then the elderly and palliative care services. Now Government of India has introduced one national program to take care of the elderly, and the palliative care, it is again under cancers, under non-communicable diseases. Emergency medical services, of course, for a primary health center doctor, it is only the stabilization of the patient. Otherwise, you don't have to do anything much. You can just arrange an ambulance. What is the number of the ambulance which you will call on? It is 108. Please remember, call on it and shift your patient. Summary. I just want to summarize for the whole 4 classes which I taught you all. It is much for me to put on the slides, so I just want to tell very main important points. The medical officer of the primary health center is not only a physician, he is a manager. He has to manage everything at primary health center. All other things you kindly go back and read. Read PARC, not any other book. I don't ask you all to read any book other than PARC. Just read PARC. If you don't understand, get back to me. Do you all remember my name? I am Dr. Sugna. I repeat, I am the professor in the Department of Community Medicine in this institute. So you can approach me. I will clear all the doubts. Please read PARC, the latest edition once more. So next is our assistants, that are those are supervisors. What do? They supervise the work of workers, both male and female. It is like they go together, they do at one time everything and come back. They will also guide the ASHA workers. Then what does the health female worker, male and female do? They are at the ground level. They have to do all the work. Everything they have to do. You understand what I mean? So they should know their community, they should know their population, they should know what is the birth rate, how to organize an immunization session, everything. So they are very important. Whose help do they take? They take the help of the link worker. Who are the link workers? ASHAs. ASHAs are the link workers. In addition, we also have the trained birth attendants. Those days we used to call them as DAI, but now we call them as trained birth attendants after they get trained. There was a training program. Now we don't train them. We want to promote all institutional deliveries. Institutional deliveries help in reducing the maternal morbidity and mortality. Ultimately, we want our women to be alive. Do you all think they should be alive? Because they are undergoing pregnancy, delivery, everything, taking care of the kid. So they should be there. Okay. Then your Ayushman Bharat, it's a very, very important thing which you all should know about it. What government is doing, you should be updated. You should get updated by yourself actually. But as a part of this class, I just wanted to tell you all, it's not there in your PARC, it's not there in other books. I don't know about the latest because I had 24th edition. Later I didn't buy. So Ayushman Bharat is very important. It is all the people irrespective of their family size are covered. So thank you all very much. Any doubts please? Just put in the chat. I'll wait. Any doubt you can ask me. I will respond. Thank you all once again. Six more minutes they can ask. With today I have finished primary health care. 4 classes. I have covered almost everything. It is for them to read now. If they read, okay. If they don't read, it's up to them. If they actually make nice notes, no, they can easily get distinction. I told almost everything what is necessary for them. And most of them don't even, when they ask about the principles, they write elements. When we ask for elements, they write the principles. I don't know why, because they don't attend the class, that's the problem. ఏం అడగలేదమ్మా? అడుగుతారా? ఇంకా ఒక 5 నిమిషాలు ఉంది, వెళ్ళిపోవచ్చు. Okay, if there are no questions, shall I just thank you all once again. I am just closing the session. Done? అది అక్కడ వెళ్ళాలా, స్టాప్ స్క్రీమింగ్ అని పెట్టాలా?